Hey guys, Raquel here. Happy Friday. I just wanted to do a quick talk about that I was inspired to do this morning because I was just at an oncology slash hematology conference today, specifically dealing with blood cancers. And I ran into three former colleagues who I adore, Matt, Sean, Rich, from three different companies that I've worked with in my pharmaceutical career. And I think one of the coolest things in talking to them was they were really interested in what yoga therapy is and how it's working with cancer patients, how it differentiates from going to a yoga class versus working with someone who has expertise in cancer. And as I really thought about it after I came home, as I prepare for a clinic this afternoon, I started to think about what are the differences, or what does a yoga therapist do within the context of working with a cancer patient. And really simply put, there are three things that we focus on. Number one, we're a partner. We're a partner for the patient. We're a partner for the oncologist, someone that can work together to create a total treatment program for someone who's battling either an initial diagnosis or someone who is in the midst of going through treatment, either chemo or is on chronic therapy with a targeted therapy, or someone who is at the end stage who has decided not to pursue any more treatments, or who is looking at the part of dying that sometimes and oftentimes comes along with certain cancer diagnoses. So those three components we're uniquely trained in as yoga therapists, and so being a partner to that healthcare provider and to the patient is one of the most important things and one of the coolest things I think about, having spent my life in oncology. And digging just a little bit deeper into the why and what's behind those things is that the growing body of evidence for applying yoga therapy as an adjunct modality to conventional treatments is that the first is, when you get a cancer diagnosis from people that have told me, as well as family members, you're seriously overwhelmed. You're in shock, and there are so many cases where you don't have time to even really think about it. When they want you, meaning they, the oncologist or the surgeon or the radiologist, wants you in immediately to start treatment, because you just sometimes can't even waste a few days. And so it's helping someone with an initial diagnosis take a step back, take a breath, maybe even offer some deep relaxation and meditation just to help them sort their thoughts out. So that's number one. The second is side effects. All the cancer drugs I've worked on, even some of the cures such as Gleevec and others, still offer some sort of side effects. And through different breathing techniques or deep relaxation meditations, we can work with the person as they're getting their chemo or their targeted therapy or whatever it is, to help reset the nervous system, which is often the culprit to what triggers so many of the anxiety, the fear, even some of the nausea that's not drug related. It can be mitigated by using yoga therapy as an intervention. The third is that from a grief and dying perspective, we're trained in, as I mentioned a second ago, in trauma and how to handle that. And we can sit there and be present for the person who is going through this, even their caregivers, and help them develop and create the way they actually would like to go on to the next life for them, or their next place. So anyway, I just wanted to share that. I love going to these conferences. I always try to stay up on top of the data because I want to understand what patients are being given, what options the people have, what side effects they might experience, because I want to continue to be an expert in that space for them, to help them as much as I can. So anyway, thanks for listening. And if you know someone who is just recently diagnosed, someone who's going through treatment, or one of the caregivers, please find a yoga therapist. Reach out to me if you're local or you want to do anything over audio or over FaceTime. I'm going to be tailoring a lot of my website to oncology, just because that's one of my passions and spent my whole life in it. So anyway, happy Friday again, and remember to just live.